Welcome to today's Explainer. I want you to picture a calm ocean at night. Just a massive, completely isolated vessel cutting silently through the dark water. Hundreds of passengers are on board, right? They're expecting nothing more than a relaxing escape, moving freely from port to port. But somewhere along that journey, an invisible threat actually came aboard with them. Today, we're not just looking at a standard textbook medical case. We are breaking down an active, unfolding crisis that has literally put the highest levels of global health authorities on high alert. We're going to explore how a single isolated voyage sparked an international emergency, and we'll use the official data to piece together this dark public health mystery. Let's get started.
A single ship, multiple countries, a deadly threat. Just sit with those words for a second. It started like any ordinary leisure cruise. You've got the open decks, the evening entertainment, passengers from all over the world just sharing the exact same spaces. But this vessel was unwittingly carrying something else entirely, a pathogen that doesn't respect borders, it requires absolutely no passport, and it completely ignores port authorities. When an invisible threat travels freely across international waters like that, the stakes escalate to an unimaginable degree. We're essentially looking at a scenario where a vacation becomes the perfect silent vehicle for disease transport.
Okay, let's dive into this. Listen closely to the exact phrasing from the official incident report. Public health agencies like the World Health Organization are monitoring a deadly cluster of hantavirus cases traced back to a multi-country cruise ship. Really feel the sheer weight of that statement. This isn't just some internet rumor. This is a severe, escalating incident that has warranted the direct, immediate intervention of the WHO. The suspect is completely microscopic, and the crime scene, well, it's floating somewhere out in the open ocean.
And I really want to focus your attention on one specific number right now. 1. Just one single international vessel is at the absolute epicenter of this entire global alert. In our vast, heavily interconnected world, it is honestly staggering to realize that it literally only takes one vessel to trigger an international health crisis. Look, authorities aren't looking at a widespread multi-continent outbreak just yet. Instead, they are tracing a massive, complex web of potential international exposure back to this one solitary floating origin point. The whole shebang leads right back to the number 1.
Now, what's really interesting about this concept is the specific epidemiological terminology the investigators are using here. A cluster is defined as an aggregation of cases of a disease closely grouped in time and place. So why is this definition absolutely crucial to our understanding? Well, classifying this as a cluster changes the narrative entirely. It takes a series of random, tragic illnesses and transforms them into a targeted public health mystery. It means these cases are definitely not a coincidence. The shared time and place, that specific cruise ship, is the smoking gun. It basically turns a luxury liner into a medical crime scene that investigators now have to meticulously deconstruct.
And this brilliantly illustrates the dark duality of this entire crisis. On the one hand, you have the innocent expectation, right? A multi-country vacation, leisure, exploration, safety. But the grave reality? It's a moving transmission network. Cruise ships are essentially floating cities. They have closed environments, shared air circulation systems, communal dining, and super close-quarter corridors. When you introduce a lethal pathogen to that specific environment, and then you physically sail that environment from country to country, you're looking at the perfect silent mechanism to transport and amplify a crisis way before anyone even realizes they've been exposed.
The pathogen at the center of this manhunt is Hantavirus. Notice the extreme gravity of the word deadly preceding it in the official reports. Hantavirus is a severe infection. It's often characterized by a rapid, frightening deterioration in patients. Now, here's a crucial insight into why this particular case is so alarming. Hantavirus typically spreads through exposure to infected rodent droppings in dusty rural environments. So, finding it spreading among passengers on a modern luxury liner, that is highly unusual. The fact that a pathogen like this was moving completely undetected among people, passengers who would eventually pack their bags, disembark, and fly back to their respective homes all over the globe is exactly why this specific virus has triggered such an unprecedented level of global alarm.
So, let's look at exactly how this escalated. Investigators used a very methodical timeline to piece this mystery together. Step 1. Cases emerge. Patients pop up with severe symptoms, seemingly totally disconnected from one another. Step 2. The investigative breakthrough. Health officials finally connect the dots, tracing these severe cases back to a single shared environment, our floating transit hub. And Step 3, the immediate consequence. Global monitoring is activated worldwide. It's a precise, chilling sequence of events that maps exactly how a localized threat suddenly erupts into an international medical emergency. The sheer scale of the reaction here really highlights the gravity of the situation. Just look at the powerful forces mobilizing. We've got national public health agencies stepping in. We have the World Health Organization taking the lead, and they are forced to monitor this on a massive, multi-country scope. I mean, think about the absolute logistical nightmare of that. This isn't just a local hospital issuing a quick regional warning. No, this requires a massive, perfectly coordinated response to track down passenger manifests, issue cross-border medical alerts, and hunt for clues left behind by this floating threat. It is literally a desperate race against time.
Which brings us to the ultimate haunting question of this explainer. In a highly connected world, how do we monitor a deadly threat that moves freely across our oceans? A single ship crossed borders without asking permission from the virus it carried. Distance, it seems, just no longer protects us. As global authorities continue their desperate monitoring of this cluster, we're left to deeply ponder the fragile nature of our health security. The ocean might separate our countries, but when it comes to an invisible threat, we are far closer than we think. Thank you for joining me for this explainer. Stay informed, stay vigilant, and never stop questioning the world around you.